Welcome to Independent RX Forum with the National Community Pharmacists Association, America's leading advocate and business education provider for independent community pharmacists. Independent RX Forum is powered by RX Connection.
Hello and welcome to Independent RX Forum, the official podcast of NCPA. I'm your host, John Beckner. We're glad you could join us. Our topic today is opportunities and innovations in community practice. And my guest is Ed Cohen. Most people know Ed. He almost needs no introduction, but I'm gonna give you a brief introduction anyway. Ed is a distinguished pharmacy professional with extensive experience in pharmacy operations, clinical services, and healthcare consulting. As the founder and chief operations officer of Pharm Team Associates, he leads a full-service pharmacy and healthcare consulting organization. And I must add that Ed has always been a staunch supporter of pharmacist-administered immunizations. Ed, welcome.
Well, thank you, John, and thank you for that introduction.
So I'm sure most of our listeners are familiar with the fact that today's community pharmacy has been described as the front door to healthcare, providing essential healthcare services. And this has become increasingly important as the primary care shortage in this country has gotten worse. So talk about that in terms of what that presents in terms of opportunities.
Well, first and foremost, your practice, excuse me, is right in the neighborhood where most people live and work. And you're there as an accessible and essential healthcare professional. So it's a natural that the majority of people will come to you and they will see you more than they see their physician or any other healthcare professional.
Right. And that can mean different things to different people.
That is true. That is very
doesn't
true.
mean that sentence doesn't mean the same thing to everybody.
That is true. So let's just let me ask a question. I'm going to present three scenarios, and my question to you is: which one? Not you, John, but our audience. Which one might you be?
Sounds interesting.
Yes. So. Scenario number one: pharmacy owner Laura is very slow to adapt to anything new. Okay. Struggles to find things that are new because she just doesn't like new things. She has embraced immunizations and some other services, but struggles to get beyond that. Down the road, in the next town, we have Sally, who has embraced new services and new opportunities, but does it without what we call a professional home.
Okay.
So not affiliated with the College of Pharmacy, not affiliated with any organizations, does all her research on her own, and builds her programs homegrown by herself.
Was the first person that you mentioned, was that Laura?
Laura, yes.
Does she have a professional home?
Laura has nothing.
Okay. All right.
Laura is kind of an island out there.
Make sure I've got all the facts.
Yes, sir. And then there's Mitch, who's a little type A.
Okay.
Mitch is always looking for something new. Mitch has a professional home. In fact, Mitch has got 2 or 3 affiliations that build his professional neighborhood. In this case, because he's very active in a local association, the state association, and a national association. So putting all that together, plus he's also very active at the College of Pharmacy.
Okay.
So as an independent community pharmacy owner, he spends a lot of time precepting students, but he's also collaborating with the college in research opportunities. He shares some of his time on a regular basis to go in and teach different courses and meet with students at the College of Pharmacy. So He's very progressive, very in tune, and he is a very sought after practice site, not only by students who go on their IPPEs and APPEs, but new practitioners as they graduate, they look to him for advice on where to go to practice. And some of them can get a job there. They'd be very happy.
So, is it an accurate statement to say that a lot of these opportunities for development of programs, innovation, uh, come as a result of a pharmacist being affiliated with the School of Pharmacy or having a professional home, as in being a member of NCPA
Yes.
or their state pharmacy association?
Well, I will tell you that the simplest and easiest way to learn and advance is to have this professional home
Right.
and build a home that offers you local and national perspective. So NCPA, as Mitch does, there's a local in the area where he lives, a small pharmacy association, and then there's the state association, and then of course then he goes off to the national association. So he's getting information on all fronts, and he's collaborating with the School of Pharmacy, which gives him an opportunity, which helps him tremendously to stay progressive. And as he wants to test new programs, new opportunities, the school is happy to partner with him to do research. And a lot of this comes at no cost to the store because the school has requirements for faculty and students to do all of this work. So it really comes as a natural fit for his business.
Yeah, and also with the schools, I remember when I was with a family-owned business in Virginia, U Crops, and we developed our immunization program. We would not have been able to do it without help from the shared faculty, community residents, so many students that came through that program because they really wanted to have that experience, which is
Yes.
a new experience administering immunizations.
Yes. Back in the day, we both had relationships with colleges of pharmacy, and that's what helped us to develop that new program and every program that has come since then.
So when we talk collaboration with the schools, we're talking about could be a variety of different things.
Yes, and it's really so important to do that. I think it's quite an underserved area, if I can use that word.
Yep.
And I think that's a place that there's a lot of opportunities that can be realized with that relationship.
All right. So let's talk about opportunities that exist because one is a member of an association. I know NCPA has a lot of different programs. We get a lot of support from industry for pilot programs. One of the most recent one was um, a grant from Bristol Myers Squibb looking at the impact community health workers uh, had on non-medical um, drivers of chronic disease, and also involving community health workers in atrial fibrillation screening.
Yeah.
So that's an example of access to something like that that you wouldn't necessarily have unless you were affiliated with NCPA or part of a CPSN network pharmacy
Yes.
that's providing enhanced services.
Yes. By yourself, as Laura, slow to adapt and slow to embrace new programs,
Right.
not being connected to the rest of the professional world.
You don't know what you don't know.
Don't know what you don't know. And none of these opportunities are being presented or can be realized. A drug company most likely would not come to a single individual small neighborhood pharmacy to do a research project or any kind of pilot work.
Yeah.
They would look for a network, and they would look for a bigger presence.
They want to be able to show impact.
Yes.
And hard to do that with just one pharmacy.
Yes.
So this going further with these opportunities, some of the opportunities that are out there may not be readily apparent. I mean,
That is so true.
you think of opportunities meaning access to different types of clinical programs, things like that. But there are other things that may not come to mind initially, but are still really, really important.
It it all boils down to what I did in my career. Let me use myself as the example.
Please, yeah.
Um,
And you've had a stellar career.
why? Thank you. When I became director of pharmacy, um, I I thought I was knowledgeable and worthy of the position, but I didn't want to just believe in myself. So I went back to the College of Pharmacy. I went back to the national associations, the state association, and I went looking for information. I was willing to donate some time to those opportunities so that they would feel better sharing information back with me.
Mhm.
So I took that burden on myself as director and incorporated those responsibilities into my daily activities.
Yeah,
Um, you know, what's a 10-hour day if you can't fill it up with a lot of stuff?
exactly.
So that helped me. That really changed um, my entire career path by being affiliated with all these different organizations. And it brought to light opportunities that I was not aware of and truly didn't understand. So, research opportunities, getting published, an amazing opportunity um, to do that. And as far as your customer base, your patients, nothing would make them feel more confident about your abilities than to see that you partner, you teach, and you do research in the area of pharmacy. That really is from a marketing perspective, it's something that you could really share with your patient base.
So, one of the biggest opportunities uh, today may be in the development of staff. Uh, More and more pharmacies are really taking advantage of technicians and expanding their role. And obviously, this really was accelerated during, I hate to keep bringing up COVID, but it was accelerated during
Oh,
COVID
yes.
when technicians were allowed to administer immunizations. And pharmacies have been able to grow their immunization program because of the involvement with pharmacy technicians. Another example would be more and more pharmacies are using community health workers.
Yes.
So those are two things that at first glance you may not think of, but when you really dig down and you know uncover everything, they're really pretty impactful
Yes.
in terms of what a pharmacy can do.
In addition, speaking of technicians, colleges of pharmacies, many of them have programs to teach and help you train your technicians. That's on the one side. On the other side, many pharmacies are realizing that technicians that have a certification and extra training
Right.
are capable of moving into management positions. And there are some that are pharmacy operations managers where they run the operations of the pharmacy, where the pharmacist on record just takes care of the professional aspects
Right.
and the licensure.
And I just, speaking of technicians that have taken on leadership roles, I interviewed one on a recent podcast, and it's quite remarkable what this particular technician has done, and I think she's become a really great role model for other technicians
But
to follow.
as you will be reminded at the next annual meeting, there are many folks like this one young lady that
There
you
are
interviewed
there
that
are
are stellar technicians that without their opportunity to advance and take on new roles and responsibilities, the store owner would not be able to realize some of these new programs and uh, revenue stream. Like, why ask a pharmacist or tie a pharmacist time up with operations and other uh, tasks when you could have technicians advance into different roles and they could take on this? It's a lower cost person for the pharmacy, yet a very capable person to do this.
and we do see a lot of technicians transitioning to the role of community health worker.
Yes.
And they really do have a leg up because they have an established relationship with their patients. And community health workers, their success is really predicated on that relationship that's already been established.
And nothing differentiates a pharmacy more than having core pharmacy services and the community health worker and the services that they bring. Nothing will differentiate you more than having that combination.
Exactly. I know community health workers that have been or continuing to be involved in specialized programs like diabetes prevention and DSMES. And I think the sky's the limit in terms of what they can do. And they can become a huge uh, differentiated revenue stream. We think of fee for service for community health workers, but if they're bringing value in terms of
Mhm.
saving money, uh, total total healthcare cost by virtue of the service that they're providing, there may be some value-based contracting opportunities available for these people.
So as you can see that opportunities are not just black and white, they're technical. They're in
Exactly.
all different areas and expanding on your professional home, embracing new and different opportunities that help you to work, let me cliche a bit, work smarter, not harder,
Right.
and having these additional resources that don't have affiliated costs is a real positive opportunity for these professional practices.
Yeah, that's a cliche that never gets old.
Yes,
So
I know.
it's okay to keep using that.
I
Yeah.
I think if when you think about opportunities, you want an opportunity that you can advance your practice, but you want to do it in such a way where you're not killing yourself to do it.
Right.
And if you can work smarter using outside resources, oh gosh, that's the professional home. That's the whole key there.
Great thought. And I want to mention another opportunity, and that's you and I co-hosting the podcast at the annual meeting in Kansas City. I think it's October 3rd through 6th.
Yes.
Excited to be doing that again with you. We've done it the last couple of years, and excited about having a whole new panel of guests this year to talk to, and I look forward to working with
You know, John, you come up with some of the wildest guests too. I mean, yes, the core leadership of the association and others, but I think we interviewed a gentleman from the
you.
world,
Australia,
yeah, Australia,
right? Yeah,
the World Pharmacy Federation or something.
exactly.
It was just amazing. It was hard to understand that guy. He had that little accent.
Well,
It was a little, I had to listen,
yeah,
twice.
some people find me hard to understand.
You do have that twang. You do have that twang. But yeah, we're gonna. If you're at the NCPA annual meeting, stop by, say hello to us. If we're busy podcasting, you can leave a mark by just waving hello from the window. So with that, John, I'll let you close it out.
Ed, thanks for joining me again. Always enjoy talking with you and getting your insights on professional issues. And thanks for being with me.
Thanks for having me.
And thanks to everyone who tuned in. We encourage you to continue to listen to Independent RX Forum on whatever platform you get your podcast on. Thanks for tuning in.